The hip joint is quite a complex joint. It's essentially a ball and socket joint. The ball part of the joint is from the pelvis, and the pelvis is made up of three different bones: the sacrum, the ilium, and the pubis bone. The ball part of the joint is the femur bone of the leg, which is essentially the thigh bone. It's got a shaft, a neck, and a ball, and together the ball and the socket articulate. The hip joint has got some very strong ligaments in the pelvis, which are the strongest ligaments in the body, and the whole thing is reinforced by muscles and ligaments. There's also something called a labrum, which goes all the way around the socket, which deepens the socket and gives it some more stability. Mostly in the hip, winter sports injuries are either fractures, that can be either to the pelvis or to the femoral neck or to the femoral shaft, or sprains and strains around the hip joint. Now, there's not very much work being done in terms of looking at specific chronic type injuries to the hip, but there are a few suggestions that some skiers have a history of labral tears, and that's the labrum that deepens the hip socket joint, and some people may be more susceptible to them.